You're listening to Through Help and Back. Through Help and Back is a podcast focused on mental health, addiction, treatment, recovery, and all things related to personal improvement and wellness. Don't worry, we're not here to talk about problems without solutions, and we're definitely not here to talk about struggles without success. So come with your problems, leave with our solutions. One of the key words that gets thrown around in mental health and therapy and psychology and everywhere, and really, movies now and media, is this term of trauma. And our guest today is going to help us with that term. She's going to give us a better understanding of what trauma means. And more importantly than that, she's going to share with us some of her successes and some of her strategies in dealing with trauma in a positive way. So my guest today is Kristen Hernandez. Kristen Hernandez is a licensed clinical social worker currently working in Illinois. Like I said, she is an expert in trauma. She's an expert in working with families, individuals who've suffered from that, and she has a different perspective on dealing with trauma that I think everybody's going to benefit from. So, Chris, I'm so honored and thankful that you made time for us today. Welcome.
Thank you so much. I'm so excited to be here.
I also appreciate you letting me off the hook on the Illinois thing. I know I blurred into that really hard. So
you saw my face right away, like, oh, he said that S.
I just wanted to find out right off the bat if we were going to get along. I know there's something to that. So what is the proper pronunciation? Is it with the S or without?
Pretend the S isn't there. Yep.
Illinois. There's no S. All right. So
there's no S.
She's practicing in Illinois. So, but is Illinois where you're from? Is that where you've landed?
No, I grew up in the suburbs outside of Chicago, and I lived here my whole life until I lived in Spain for a little bit. I've lived in Miami. I've lived outside Atlanta, and then when I had a kid, had to come back home. So I'm back in Illinois again.
I had to bring back to Illinois. So take that, Atlanta and Miami. You lost out to Illinois after all. So that's great. So what has it been like? Just raising a child in Illinois. Are you guys enjoying it? You're having a good time?
Well, my kid is by far my favorite person in the whole world. So he, I think we'd be having a great time no matter where we were at, but definitely like being back by our home base, by family and friends and things like that for sure.
And you get to be his favorite person for a little while. We were kind of joking before we started filming that children as they age have different relationships with their parents and it evolves, but your guy still likes you, so that's good.
Well, let's be clear. He's actually still in love with me. I'm the love of his life still, and I'm holding on to it as long as I can.
Well, and that comes full circle, right? Like they have their independence, but then they learn a little something, and then when they become adults, they come back and Mom, I loved you the whole time,
I'm going to hold you to that. So I really hope that plays out for me.
I've seen it. I have great faith that that's going to happen. So I know that you're in private practice now, right? So it's Olive Branch. Is it Olive Branch Mental Health? Is that the name?
Yeah. And really the name came from the idea that to me, therapy is really about extending an olive branch of help and just creating a safe space of support. And it doesn't hurt that I'm Greek. And so Greeks will use olives anytime that we can in anything. So yeah, that combination worked out.
That's perfect. A little nod to your background as well. So how did that evolve? Have you been in practice for a long time, or is this a new venture?
I've always kind of had that idea of wanting to do my own thing. Back when I lived in Georgia, I had started a nonprofit for providing trainings on mental health for anyone, for communities, schools, families, really anyone that would have me come do presentations. And that first started because I was getting frustrated how often people were referred for trauma therapy after an really huge situation, like a suicide attempt, like a tragic loss, when there were warning signs. And my frustration, I had to recognize I'm frustrated because somebody doesn't know something. You don't know what you don't know. And I wanted to turn that into, let's make this information more accessible. So I had originally had a nonprofit there called Every Story Matters. And while I was doing that, had a small private practice on the side. Ended up, when we came back to Illinois, really going into executive type positions in nonprofits. And I had some frustrations in those positions and some frustrations of just how things were run, and not to lean on Frank Sinatra too much, but I wanted to do it my way. So I opened up Olive Branch Mental Health about a year ago.
What types of clients are you seeing? Are you trauma specific, or are you open to different modalities? Like, what is your population that you tend to work with?
It's interesting because when we say, like, I see clients with trauma, I think everyone has some variation of trauma. We use that term, and I feel like a lot of people get caught up on what qualifies a trauma. And the reality is, it's not like we have a list of situations or events that we're like, oh, that happened, it's traumatic. That's not how it goes. It's more about the impact on the individual. But just very organically, a lot of my clients have either been children who have experienced, unfortunately, sexual abuse, or women who have come out of abusive relationships. Those have kind of been just naturally who has been drawn to my practice.
Well, even talking to you now for just a minute, I mean, every story matters, Olive Branch. I mean, there's certainly a warmth that emanates from your work that I can see that being something that would draw somebody in who needed, shelter and care, honestly. So that's not surprising to hear that. Yeah, no, it transmits really easily. So let's dive into that, because you said some of the things that people mistake about trauma. So going back to your education days, I've certainly been there. Okay, there's been an event at the school. Okay, somebody made an attempt on their life. Now we need trauma work. Your position was always, actually, you needed trauma work long ago. We're seeing like the outcome here. So what is it that people miss about trauma or don't understand about trauma that leads us to this reactionary place, in your opinion?
I think that, especially if I'm talking about childhood trauma that has happened for a lot of people, our brains are these magnificent things that will protect us at times. And so when you've gone through a traumatic event as a child, your brain can actually block the neurons from connecting where you don't remember the event. And so, or perhaps a child has been told at the time, like, don't tell anyone. If there are some kind of victim, they may even been told, do not tell your parents, do not bring anyone else into this. And then they block that memory and they think, I'm going through life okay. A very common misconception that can happen is if you look at the symptoms, for example, of PTSD, and you look at the symptoms of ADHD, on paper, they're almost identical. So there are a lot of kids out there who have been maybe really disruptive, as I say, like I put air quotes, disruptive in class, or they're like the troublemakers. And I keep doing air quotes because I kind of hate any negative term on a kid, but they're the ones who are not functioning with the expectation that the teachers put on them. And it's a lot of times it could be because something happened and they have a really hard time focusing. They are having a hard time connecting. They have anger outbursts because they've pent up all this emotion and they don't know what to do with it. And because of that, oftentimes kids are put into these categories of being like a bad kid, being a troublesome kid. And in reality, these are the kids that need our help. And they needed the help way before they get expelled from school, way before they're in such a serious situation that now court is involved and things like that.
I think it's important, especially with kids, to remember you talk about the wonderful brain is the developmental cycle and where they are in their stages of development, right? So to expect a 6-year-old or a 7-year-old to be able to verbalize what they're feeling and the depths of what is really going on is kind of silly if you think about it, right? But they do know how to throw a chair and they do know how to toss their crowns on the table when they're feeling a certain way. And so I think when parents and caregivers can remember that all behavior is just a form of communication and it's not inherently good or bad. So what is him throwing the chair telling me, or what is he saying by throwing the chair? And that's a hard thing to do when you're in a room full of 30 kids, or when you're at home and you're tired at the end of the day. But it is an attempt at communication, even though it looks very problematic. And I just think people miss that,
Yeah, I had a kid that, this is years and years ago, but a kid who they had a program in their school for in-school suspension. And if you had 3 in-school suspensions, your one parent had to come spend the day with you at in-school suspension. This kid did everything to get that 3rd in-school suspension because he so badly wanted to spend a day with his dad. Like that was the goal. And it took a long time for us to connect those dots and figure out that that's what was happening. But all his kid really wanted was some undivided attention with dad.
Inadvertent consequences, right? And unintended consequences. And what's the payoff? That's another thing when you're evaluating behaviors. What are they getting out of the behavior? If you can reserve that good and bad judgment. We worked at a residential facility in Dallas one time, and we noticed that the kids who were bad and acting aggressively, there would be 8 staff members over there working with them, right? And all these kids that were going to group, handling their business, moderating their emotions, were almost getting neglected, right? Because by virtue of resources, you only have so much time, and this is noisy. So they would run over there, and we sort of flipped that on its head where when the acting out would happen, go to the ones that are actually on track, reinforce them and thank them for being, on track. And how are you guys able to do this? What can we do to help him? What are you guys doing differently than he's doing? What can we do to help him? And what you would see, it's so funny because these are 17, 18-year-old, gang members, the tough kids, right? I'm doing finger quotes with you. And you'd see them over by the wall, kind of like looking, like watching, like, what's going on? And eventually they come back because that's what they really wanted, was the attention and the care, but they don't know how to ask for it,
Yeah, it's working. Like, it's essentially like they see like, oh wait, doing that's working. When I used to go into a school, there was a middle school, I used to go in and see kids for therapy just as part of our program. And I used to get referrals handed to me at the front desk, like, well, here's a lost cause for you. Here's a bad kid for you. And I would correct it over and over again. And then one day they handed it to me saying all kinds of these negative comments. And I hadn't met the kid yet. And I said, all right, do you know what period he's in? She goes, oh, he's actually right behind you. And I said, you just said all that in front of him? And I just paused and went, all right, I'm going to come back to this, And I turned to him and I was like, well, that was ridiculous. Made a joke with him about it. He's laughing with me. And I was like, all right, let's just go, because this is not an environment we need to be in. And I don't think there's this awareness. And that's where I really want people to have, and this is why I'm such a big fan of what you're doing. I want people to have a better understanding that we all need to understand mental health. We all need to be trauma informed, because no one gets out of this life unscathed. No one. And we've all, I love telling clients, you've survived 100% of the things you faced so far, but that also means you have faced some stuff, and so has everyone else around you.
What drew you initially? Because certainly in the big world of mental health and psychology, there are sort of less volatile areas of study, and I'm not ranking those as better or worse or easier or harder, but almost like a fireman to be drawn to the fire, right? Like what brought you to this interest in trauma work, and why has it been so important to you?
I wish I could go back to, I wish I knew this social worker's name, and I wish I could have her picture on my wall. But when I was a kid, I had a lot of medical health stuff. I spent a lot of time in and out of hospitals. And I remember being about 6 years old and being in the hospital, and everyone was talking around me, doctors, parents, all this, everybody's just talking around me, and they're really scary terms. And a lot of adults are crying, and there's a lot happening, and I didn't understand. And this social worker pulled me from the room, took me into a play area. We made little cast finger puppets, and she had a conversation with me about what was going on using the finger puppets. And it was the first person in the week I had been at the hospital that talked to me and directly to me and made sure I understood, even at 6, what was going on. And I just remember asking her, what do you do? And she said, I'm a social worker. And at 6 years old, I remember going, yep, that's something I need to learn about. So it was at a very young age, but that's not necessarily trauma work, but social work.
Yeah, no. And then fast forward a couple of years and you're in a school talking to a child instead of talking about a child, right? I think there's no coincidence to that. So yeah. That's amazing. So that got you into social work. And then the trauma, was it just find a need and meet it because you had so many traumatized kids, or what brought you over to that specialty?
Well, as you know, a lot of us when we're in grad school, our internships are never what we think they're going to be. And I was honestly, in retrospect, very lucky that I got placed in state psychiatric hospitals. And these were all not guilty by reason of insanity individuals. And a lot of people I had worked with had diagnosis of schizophrenia. They had committed murder. There was some really extreme stuff going on. And I ended up getting even a job at the hospital after the fact and spent several years with that population. And while, I mean, I was fascinated by it, anyone who is in this work, I was just absolutely fascinated. However, unfortunately, there are people in those situations that it's really hard to see that things are going to get much better than they are. And I became fascinated with what can we do earlier on that could have prevented this. And it transitioned me into how can I intervene when the trauma happens, when someone's been through something, so it doesn't go unnoticed and get to that point.
An ounce of prevention versus a pound of cure type mentality on it. So, and that's actually kind of a hot topic right now when you're talking about institutions, and in America specifically, a lot of institutions have been shut down, have been overregulated out. And there's kind of this, I don't know if it's a push or a groundswell of support, but there's certainly this conversation about, you know, maybe we should reinstitute some of those places. Maybe we don't need people on the streets at the level that they're at, you know. Having had that experience, and I know we're kind of diverting a little bit, do you have an opinion on that? Do you think those are functional facilities and would be beneficial to society and that person? Because if their growth is capped, you know, they need to have some sort of solutions for their life. So where do you stand on that?
I am definitely in favor of those types of institutions. However, it depends how they're run. I have been in some that I would say this is worse than prison. This is worse than anything. And no person should be treated this way. And then I've been in others that when I say like, it's not necessarily going to get better, it can get better, but not necessarily a place where they're going to be able to function independently outside of that space. So having a safe, comfortable space where somebody feels valued and they are protected both from themselves and from maybe the triggers that have impacted them in the world, I think can be a really great outcome. But again, it has to be run in a way that values that individual, that doesn't look at somebody as a number, as money, as I just want them out of the streets. But no, this is a person who clearly has been through some hard things. They did the best that they could. It's had a really unfortunate outcome. And now we want to try and give them the best support that we can.
Yeah. Yeah. No, and I think I share some of your views on that, and I worry a little bit because a phrase that maybe not everybody knows is this idea of levels of care, right? And so you want the least restrictive level of care possible. And, you know, I run an agency that is outpatient behavioral health, and, you know, hospitals, police officers, emergency services, they'll bring me clients that should be institutionalized, right? But you're the only thing we got. So all of a sudden, if all you have is a hammer, everything looks like a nail. Like, nope, I think they can be managed at outpatient level of care. So my one fear is if we equip that, again, does that not become a catch-all for everything, right? And I think the answer there is good clinical judgment. Let the clinicians be in charge, not the administrators, and rely upon ongoing assessment. It's not once a year, you know, it's monthly, good record, you know, good transparency. I think that's part of the answer there. But I do worry about it being a catch-all. So
I agree with that. I also think, I don't know if you've ever thought about this. I was having a conversation with a colleague about this same concept. Our highest acuity population in the world, the ones that really do need serious, really professional support, are often seen by the brand new, right out of grad school workers. With the most inexperienced clinicians are often matched with the most in need population. And it's because, unfortunately, they're not getting paid well. They're not being valued as employees. They're not getting the support that they need. So they put them in these burnout jobs. Well, now you have the people who needed the help so badly being treated by people that may have the best intention, but they don't have the tool set. I mean, I look at it and say, I was a recent grad and I was running one of those units on the hospital. I was in charge of it. That is ridiculous to me. I should not have been running an entire unit of a hospital yet. I did not know what I was doing.
Yeah, but at that age, you're like, put me in, coach, right? Like I'm ready. I can take, and you don't really have that sense of perspective and professional boundaries as well, right? Like, to be, 25 years old, fresh with a master's or whatever, put into that position to say, hey, I think this is beyond my capabilities. You need to give this to somebody else. Boy, that's a really hard thing to do in your first job. You know what I mean? You think they're going to walk you out of there. Yeah, I know.
No, I was by far the best person you could find for the job. I could do all the things. Yeah, I usually when I train new therapists, I let them know, I'm like, listen, I was arrogant. Like I thought I could do it all when I started. And thankfully I have been humbled since and recognized no one can do it all.
Well, you had read all the books, right? And so you're like, I've read all the books, so I'm ready to go.
Yeah, I read all the books. I watched Criminal Minds. I was definitely prepared, right? That's what you think at the time.
I just did a Good Will Hunting impression for like the first year and a half. That's kind of what I did, because you just borrow what you see in media and then it evolves, So I was like, hey, it's not your fault. Like every session, I'm like, it's not your fault.
How does that make you feel?
Oh, ouch. Yeah.
that one question that you're just like, got that in my back pocket. I should be able to do this then.
They luckily taught me to nod and hum and go, tell me more, And then whenever I got stuck, that's what I leaned on. Like, that's interesting. Tell me more, and I'm just scrambling in my head. So, yeah.
At the end of the day, we know, and because I want people who are new to not question themselves either, because at the end of the day, if you value people and if you treat people like they matter and like their story matters, then you're already probably giving a lot of these people more than they've ever gotten before.
Absolutely. You made a comment, and I like your phrasing there about how they put them in a burnout job. And I think that it's you talk about the terms of trauma and vicarious trauma and how difficult it is to do this job. Do you work with a lot of your colleagues and peers in terms of like dealing with their own trauma or trauma that may have incurred as part of doing this work? Because I know how I feel after 8 hours of therapy, and it's,
very draining. I do a lot of trainings for organizations on like trauma-informed leadership, how to impact burnout. I talk about how we have to have that perspective. And honestly, a lot of those things have come from my own experiences where I was facing challenging times and was seeking support from leadership and was basically instead told, no, you got to go help those families. And I could recognize that I was in a place that was a disservice to the family. And yet I was told, keep running, like keep going. It doesn't matter. So yeah, honestly, I don't have any therapists that are seeing me for therapy, but I do provide a lot of consultation and support and training in that way.
Do you have, and I'm not asking you to do a training live, but do you have 2 or 3 things that you recommend to folks who do reach out, like that may be experiencing that or feeling like they're being traumatized by their work? Like what are your, top go-tos?
By far, if I could like put a phrase over my head all the time, it is appreciative curiosity. I think that breaks down so many walls because I know when you used to go into supervision, it would be, all right, let's run down your caseload. Let's see where you're at with this. Is your paperwork on time? Is this? And if somebody instead pauses and asks like, truly, how are you? How are you feeling? How are things going? And then does it in a way that they're grateful that you're willing to share that with them, it's such a different way to approach a conversation. And if you're familiar, I don't know, but familiar with Brené Brown and her 2-word check-in, I'm a big fan of that as well, like starting meetings with the 2 words. And for anyone listening who doesn't know, it's just give me 2 words for how you're feeling today, no explanation. And then telling leaders, all right, now follow up with the person who said, I'm exhausted, I'm frustrated, I'm anything negative, do a follow-up or tailor your presentation or your meeting to the energy in the room. Make sure that you're trying to make it a safe space for everyone.
I think that being conscious, right? Like you said, I forget the phrase you just said, but the curiosity, being intentionally and conscious about your, authentic curiosity is really important, because there's the worksheet version of that where it's like, okay, it's time to start the meeting. 2 words, check, check. Okay, on to productivity. It's like that's a different experience than to actually use that therapeutic skill and be genuinely curious. Because if you're curious, you're not judging, right? You're learning. Right. Yeah, that's interesting. Where did that concept develop from? Is that yours?
Oh, I wish it was. No, I should have had their names like right there for you. But no, it was developed in the 80s, this concept, and it was part of the idea of cultural humility. For us to be humble in the world and to have humility, we have to be curious. And part of that is, you saying like that you live near the Boston area. This is kind of a silly example, right? But if I just go, oh, he's a Red Sox fan and I'm going to decide all of these things about him because of that, I have already cut our interaction in half by making assumptions, by not asking, well, what do you like about living there? What is it that drew you to it? And trying to understand your experience, your connection to where you live, what it means to you. I'm going to understand you in a totally different way.
From my background in solution focus, that fits really well with a not knowing stance, right? You have to be not knowing at all times. And I think that's hard because that clashes with the work environment, right? Because if I'm not knowing, I don't know, but I can ask and I can be curious, and then you're the expert, right? And so I'm always learning from you. Like that fits really well in therapy, but like how does that work when I'm the boss and you're the employee? It's really tough with the power dynamics that are in place to adopt that. So I think that's an interesting lesson to be more conscious of that, because I think we've got a burnout problem in the field. We've got a new therapist problem in the field. We don't have enough. They're not coming fast enough, and when they do come, they're not staying long enough. And part of it's because it's very hard. It's very, very difficult to do this.
Like, let's be real. They also tell us in school, you're not going to make money. You're going to be burnt out. You're supposed to be burnt out. You're supposed to have endless paperwork. And they like almost normalize this very negative existence, when in reality, we need these people to be in a healthy state of mind to do the work that really matters.
Absolutely. So when we're talking about some of this terminology, back to the kind of the core topic of trauma-informed, you'd said that earlier, like trauma-informed organizations or trauma-informed care. Can you define that a little bit? I know that term's tossed around in our field a lot, but what do you consider trauma-informed to mean?
I mean, to me, the biggest part of it is creating a safe space. So, if people are feeling threatened in their job all the time, like that they might lose it, they might be laid off, a lot of organizations are having a lot of mass layoffs. Well, every day I go to work, if I get a meeting from my boss, everything in me is now anxious going, am I about to be laid off? It's very hard to be present in the clinical work. So it's about creating safety and security in that manner. Also safety and security to come as yourself, to be able to say, today is not my best day. And my 100% effort today is not the same as it was yesterday. I'm going through this or that, and it's a safe environment to do that. It's also about building trust, that you can go to your supervisor and your colleagues and you can feel respected, you can feel valued, and you can trust that what they say is going to carry through.
What about from a client standpoint? So if I'm new and I'm coming into Olive Branch or some other, excellent agency, and I read on my informed consent that I'm going to receive trauma-informed care, what am I signing up for? What am I getting into?
It really depends. I do like to tailor things to the individual. As a trauma therapist, I'm also big on experiential therapy. So as much as I do have the couch back here, and some people do sit on it and we do the couch thing. Others, we go for a walk, we play games, we do dancing, we use movement, we bring fitness into it. People have different spaces that create this freedom in their mind where they can now be in like almost a cleansing environment to share some of their story. And I want it to be in a space where you're not like building it all up and now you're going to walk out my door having it just like this knot in your chest. Instead, let's do something with our bodies. Let's get moving. Let's use some of that force in our conversation. And then we always, within the trauma work, especially especially if you're newer working with me, we're going to touch on the trauma and then we're going to back far away from it. And then we're going to touch on it again and back far away from it, because I am trying to gauge how do you respond to it. I also, another additional thing that I like to do with clients, especially if we have kind of dove into the specific trauma that happened, is between sessions, they know that they can text me and have a 10-minute call if it became really triggering. And that is, sometimes we do open up an old wound and you don't always know how you're going to respond. So not making people wait an entire week if it becomes too overwhelming or difficult.
I think that safety net's important, because we kind of talk about peeling off the Band-Aids, right? And you don't want to peel off the Band-Aid too far that you can't get sort of sealed up before the session is over and get them to a safe place. Because with addiction clients a lot, we talk about this too, about they're very eager about their sobriety. And clients who engage in trauma work are also very eager to finally deal with this, right? Like, I'm going to get this off my chest. And it's like, well, not all of it today, because it actually gets harder in the short term, not easier, to bring the unconscious into the conscious, and to the stuff that you've been avoiding, the stuff that you've been treating through other behaviors and soothing strategies, to now turn and face that. It can actually introduce more distress in the short term. And so I think to prep people for that is tough, because they're very excited to move on, and it's not always so fast.
I like to use the imagery with clients. I tell them that I want them to think of those, again, this might be dating myself. I don't know that kids eat these anymore, but those giant jawbreakers. And I'm like, that sweet tart in the middle, the really soft part in the very center. And I'm like, that's the trauma. And everything else is what you built to protect yourself from feeling it. And so we are going to have to very slowly get layer by layer until we can get there.
For people that are out there, so they may be feeling a certain way and maybe considering therapy. Are there any signs or symptoms that should maybe hint to them, like, hey, you might have a trauma-based issue here? Because there's always those people who know, like, hey, I went through a car accident and I survived. So there's like that very obvious, but are there more subtle signs or less obvious signs that, hey, this may be a trauma-based thing that people should be on the lookout for?
Yeah, some things might be, some of the aspects of their life that they're not as satisfied with. Like, they keep going to unhealthy relationships. They're drawn to them. They keep finding themselves like, all right, I left that one and now I'm back. Now I'm with someone new who has very similar issues. A lot of that can be stemmed back. Of course, if some of the more obvious ones are if somebody's having nightmares or frequent anxiety, panic attacks, we would know that. But if you're having difficulty focusing, if you find yourself really exhausted a lot of the time and you're not really sure why, or there's certain environments that almost, and I know sometimes I get sick of the word trigger because it does get overused, right? But maybe you're finding yourself in certain environments. I close up. I feel this physical reaction to certain environments or certain people. And I let people know, like, trust that gut feeling. If something's feeling off, there's probably something that's gone on. And that is to say, there are some traumas that are maybe best left, like, without us diving into exactly what happened. However, we can still do a lot of work to help you create a life that you're happier and more satisfied with now. Doesn't mean we have to open that memory and find out, like, what happened when you were 3 or 4 years old. Maybe you won't benefit from that, but you will still benefit from, let's look at your environment right now. Let's look at what's happening, what's causing some of these reactions, and how can we try and create some better changes for you.
I think that's a really sort of advanced view of it, because I think the default setting is, if there's trauma in, we got to get it out no matter what. We're going to force catharsis. You've got a splinter in there, and damn it, you can't possibly be okay if you have a splinter in there. We've got to dig it out. Doesn't matter if we leave you bloody and bleeding. We got the trauma out, so we did the work. But scar tissue serves a purpose too, right? And sometimes, that you talked early on about the body's natural ways of compartmentalizing and isolating this damage so you can be functional and you can live. I think that's really nice that there's that allowance for, maybe we dig, maybe we don't. Maybe it's okay. Maybe you found a way to make this work now, and we can celebrate the success. And how did you do that? How did you figure out how to live with it? Teach me that.
Yeah.
Yeah.
And helping people recognize, like, even if you don't know what it is, you survived something. You did overcome something. And now we're going to try and figure out how it doesn't feel like survival anymore, but living. Let's figure out that change.
That's good. That first scenario you were talking about with repeating self-destructive patterns, really broad question, but why the hell do we do that? Where does that come from, right? Like, I know this isn't good for me. I'm going to go do it again. I know this person isn't good for me, and I actually don't feel great after. There's a variety of these that we could all lay out, whether it's relationships with food or sex or drugs or toxic family members or just even your own individual habits. Like, the outcome wasn't good, but I'm just drawn to it over and over. In your opinion, where does that come from?
I mean, I look at it in two different ways. One, our bodies and minds hate change. They hate it. It is an actual reaction that our body goes like, what is this? And if you've been eating, like that guy back in the 90s who did the McDonald's challenge and he ate nothing but McDonald's for however long that was for. If all of a sudden one day he ate a salad, he probably was going to feel terrible. Right? Even though he's eating the healthier thing, his body's going, this is not normal for me. I'm going to reject this entirely. So some of it is we have built up some normalities in our body and we don't know how to respond. So if I've been, and then with that, it's also, that's what it's maybe what you're comfortable with because it's familiar. If I've only been in relationships where you have told me that I am not worthy, have made me feel less than, have knocked me down left and right, and now I've met someone who wants to build me up, I don't trust that at all. Right? It is not familiar. I'm going to automatically assume you're trying to trick me. I don't think that there are people like that in the world. And everything about me is going to say, push that away because I've never seen it. I don't understand it.
How many times have we heard that where it's like, he's a nice guy, but he's too nice. You know what I mean? Like it makes me feel weird because he's too nice, and early on you're like, what do you mean too nice? Nice is part of the goal. But then you understand from your perspective, like how that can be uncomfortable.
It's either like he's too nice or like the nice is, it's almost boring. Like I'm kind of bored by how nice he is. And I'm like, well, yeah, again, your body and mind have been addicted to this adrenaline. And even though it's an unhealthy adrenaline, it's still used to it. And if it goes even further back where you experienced that as a child, how can you possibly know to look for something different? It's, back to the, you don't know what you don't know. And if you've never known healthy relationships, you're definitely not going to know how to find one and hold on to it. And let's not forget, as any therapist can tell you, till you have a healthy relationship with yourself, you certainly cannot have it with someone else.
Yeah. I've had patients even sit there and say, like, it's the boring thing. Like, I'm going to start some trouble this weekend because it's been too boring, right? It's like Groundhog Day. It's the same thing over and over, and I'm not getting that stimulation, and I'm going to start it up, and you have to kind of like work with that. Like, okay, well, what's the intent and what's the outcome going to be? Is that really the best choice for you? But it's hard to be non-judgmental in those moments because you're like, this is going to mess it up. You're going to hurt yourself again,
Yeah, you want to, as we know, as therapists, sometimes we want to say, don't date them. Don't do that. Like break up with them, like walk away.
Yeah.
Obviously we can't do that. So we have to do it in a much more gentle, trauma-informed manner. But yeah, it's definitely hard sometimes because you want to protect the people you work with too. And you want to say like, all right, I see the choice you're making. I see the outcome coming. But I will be here when it happens. I will be here to work through it.
I honor your autonomy, and I will make sure we get you on the schedule for next week. Before we go on, I want to say a few words about Anew Behavioral Health. Anew Behavioral Health is an outpatient provider of mental health and substance abuse services in Ohio and New Hampshire. That means that Anew can successfully treat mental health and substance abuse issues or dual diagnosis if you're struggling with both. Their integrated approach allows for them to successfully address issues related to anxiety, depression, addiction, trauma, and really anything that stands between your life and the life you could be living. You really cannot bring them an issue that they have not successfully treated. They have also solved one of the biggest problems for people seeking help. They have a dedicated team waiting to hear from you at helpnow@anewbh.com. If you contact them today, within 24 hours, you will have heard back from, wait for this, a real live person, and will also have your first appointment scheduled at that time. So how do you contact them? Well, if you're in Ohio or New Hampshire, you're probably close to one of their local locations. You're welcome to go in. If not, you can always reach them online at anewbh.com. And if you're interested in services for you or loved one, use that address, helpnow@anewbh.com. So if it's pattern-based, which I do believe is true in a lot of ways, how do you work with patients to help disrupt those patterns, identify those patterns, form new ones? Like, what are the steps?
I mean, the biggest thing is helping them break the pattern for themselves and start to recognize their own strengths and their own worth. I would say a big part of the work that I do with people is, there's me before the trauma, there's me after the trauma, and I don't even understand myself after trauma. I don't recognize myself. I might feel like an entirely different person. So it's helping them kind of come to terms with who they are, who they want to be, the kind of life that they want to live without anyone else controlling those choices. And then how can they start to view themselves so that they can recognize when someone else is giving them that level of worth as well?
How do you adjust your work based on age? Is working with trauma in children different than working with adults in trauma? And if so, how?
Yeah, absolutely. I actually cringed a little bit with some of the kids who've come to me. I've been told that this is not to disrespect to any therapist because you got to do things your own way. But there's so many kids who they say, oh yeah, I do trauma therapy with kids, but only via telehealth. I can't comprehend that because a kid is not going to get anything from sitting and talking to me. So we do art therapy, we play games, we play out scenarios. I have a magic wand that kids like to use and they make wishes on their life and we get to kind of play games like that. Some of the kids, the art therapy is a huge part of it. We build our own coping or skills, and we build one of my favorite like fidget things that I do, and this is just a fun DIY thing for any kid that has anxiety. We take Play-Doh and then we smell different essential oils, and it's really funny to watch like a 6-year-old smell something and her reaction. And they find one that brings them peace or joy or happiness, whatever word they say. We put it in the Play-Doh. They play with it a lot. Now their hands smell like it. They have a calming fidget toy. We do all these different techniques with kids that brings them into it where they don't know that they're necessarily talking about their feelings. Because if I sat in front of a kid and I'm like, tell me what happened to you, they are going to stare at me with just like, what do you want?
Yeah, no, and I like that the sensory stuff you're bringing into it with kids, because I do think experiential and the tactile is so impactful for kiddos, and that's just where their brain is at that moment, right? That's where they can feel it better. Yeah.
Yeah, we have I have a whole tub of stuffed animals. So every time they come in, they pick the friend that is coming in with them into the office and they get to name them. And usually they create a whole story about that stuffed animal. And we use that a lot too, to kind of dive into family dynamics, things like that.
So I'm 100% stealing that. That's such a good idea. Like that is so good. What friend is coming with you? I think that's phenomenal. Yeah. We'll have to buy more Febreze, right? You got to keep the friends clean.
Oh my God, so, yeah.
Take them home on the weekends and keep them clean, but that's good. So a lot of times when you're dealing with kids, especially, and adults, I mean, I don't want to generalize. Adults too, you're dealing with a system. You're dealing with people that love them. You're dealing with who they interact with. But with children, it does seem like obviously the parents play such a powerful role. For parents who feel like they have children who are dealing with this, what are some of the tips or some of the advice that you give them to support them in their trauma work, informally or at home or in between session? Or if somebody's in their car right now and they think their child is dealing with this, like what are some things they can do to start being part of the solution, start being supportive as their children are working through the trauma that they're dealing with?
Well, first off, I want to say if you are wondering at all if your kid has been through something, get them someone to talk to. Just automatically, if you're even on the fence, let this be the sign, just go do it. Because any quality therapist is going to assess whether or not that kid really needs it. And I'm not going to say everyone's perfect, but hopefully a therapist is going to assess it and can communicate like, no, they're doing all right, or no, this is a really healthy thing for them. It depends on the age. Like I do have some kids who are kind of teenage or that preteen age, if they're here, the whole session's just me and them, and I will talk to the parents between sessions. The younger kids, it's about half the session is just me and the kid, and half is a family session where I bring the parent in. We talk about things. I'm very transparent, and I try and talk through situations with the parents, giving them tips and tricks. A big thing is a lot of parents come in saying, my kid is so angry, and the anger outbursts that are coming out, and it is trauma based, and they can even connect that and say, I know they've been through it, but I can't handle the attitude and the yelling. And then we often do come to find out there's also yelling from the parents. So I am a big advocate on, are we giving the kid a chance to communicate how they're feeling in a safe space? The other big thing I want parents to know is you are doing the very best you can with what you have. You can only do what you know. And so when a parent is yelling, you know what? They were probably yelled at as a kid. This is what they know about parenting. So if your kid is not responding well to however things are working in your home or in the school environment, then take that to a therapist, talk to them. And if they are giving you some tips and tricks, please be open to them. And if it doesn't work, come back and tell them that. It should be a very much working relationship.
Yeah. The collaboration. I often find myself in a position where I wish I could put cameras in the home and watch the family system and the family dynamics, right? Because you're like, where is this coming from? Where is this coming from? And generally that's where. And that's not a judgment. That's just trying to look at the source of where it's coming from, To flip that question around in a different direction, when parents have a child that is dealing with trauma or has been traumatized, those are the supportive do's. Are there any hardline don'ts? Are there any mistakes or common mistakes that parents make when they're trying to interact with a child with trauma that actually do more harm than good?
Dismissing the kid, first of all, is the biggest red flags, dismissing the impact on the kid, not valuing how much it really is affecting them. Another part of it, to me, is also making it about them. Unfortunately, sometimes parents will make it about how hard it is for them that the kid went through things. And that is valid. Don't get me wrong. Parents definitely need their own source of support, and they need to be able to work on the things that have gone on as well. But it cannot be a child's responsibility to take care of a parent and to take care of the feelings of a parent. And I think that is one of the most common things that I see happen.
Yeah, I can connect with you on that. I see a lot of sort of trauma dumping from the parent to the child, which then forces the child to level up and take on that comforter role, that supportive role. The heartbreaking, no, mommy, it's okay. You see that from time to time. And you're sort of like, hey, we've switched chairs here. You know what I mean? It's like, you get your own therapy, get an adult to say that to you. This time is for them, but it's hard because if you're a parent, maybe you're a single parent, maybe you don't have a lot of resources. It's me and the child versus the world, and we're doing the best we can to make it. And that becomes that boundary crossing that can happen there. Did you, it's something that we kind of always have to talk about just in the world in which we live with kind of emerging from COVID and things like that. Did you see a pretty big uptick in the trauma work or the symptomology around trauma immediately following COVID? Has that created more of a need in your opinion?
Yeah, absolutely. And there's a few reasons for it. Some of it is people's out there, the ways that they would work through things that were going on were taken away, right? They used to go to a gym or a workout class or whatever it was, and they didn't have that, or being around friends at school. I'll be honest, the minute the school shut down, the biggest thing I was worried about was, the school is where we saw the red flags that something was going on at home. And now that abuse, the neglect, the things that it's still happening. And now that kid doesn't have a safe space outside of it. Some kids, unfortunately, that's the only place they're getting a meal. That's the only place that somebody is around them. And again, I am never judging the parent, even the parents who have been found to be abusive, to be neglectful. I can guarantee they have their own experiences of abuse and neglect, and they are doing the best that they can. But Absolutely, there were not the same level of supports or eyes on people to recognize those warning signs. You're not going to see an employee or coworker and say, they seem pretty down, they're reserved, they're this, when you're shutting down the computer after every meeting and you're not connecting in the lunchroom, you're not having those moments. So yeah, I think there was a huge, huge increase. And then I think my brother is an example that he lived by himself. And it was to me such an example of isolation. At one point he said to me, and this isn't meant in an intimacy way, but he was like, I haven't touched another person in X amount of time, like shaking hands, brushing up against someone, a hug. And we forget the impact that that has on people, especially who have experienced trauma.
Yeah, and not even just the ability to touch. I mean, just that, like, faces, I think faces matter a lot, right? And this is not a pro or anti-mask comment. It's just but when we lost that, I mean, you look at somebody at the grocery store, you're going by and you do the like, kind of little face, and they do a little gesture back. That's a connected moment, right? And I think we lost all those little points of connection along the way, and humans don't do really well without connection. We don't do well in isolation, there are those people who like choose to go up in the mountains for a while and everything like that. And those are the kind of like unique individuals, but most people need to kind of connect.
Well, in young kids, that's how they identify with emotion is people's facial, like that's how they connect with people. That's their first way of recognizing it. And so I also thought about young kids like in daycare that are seeing people with a mask that they don't understand. That's so confusing for them.
You saw those horrible videos of them wrestling masks onto kids, and they're fighting it with everything they got, and it's like it's sort of ridiculous at some point. I almost wonder, and there's overdiagnosis out there, and there's this loose use of like psychological terms, like my kids come home and today was so traumatizing, you know what I mean? But I do wonder if anybody got out of COVID unscathed. I wonder if we didn't all feel that, because just to know that the world can shut down within a week, it's how do you ever get back to a place where you feel completely like, I wonder if we're not going to have to age out of that, and it's not going to be a generation before, nobody's had that experience before we can fully get all the way back. Because just to know that any moment the lights could go out is a weird thing. How do you ever trust that they're going to stay on,
Yeah, that and it also separated us as a society so much. And I loved to remind people because I was still doing a lot of virtual trainings, during COVID. And I would tell people, it's easy to judge someone who feels the opposite as you about COVID, about the restrictions. However, both sides feel like their freedom is being taken away.
That's right.
No matter how you look at it, everyone is feeling like their personal choices, their freedom, their safety, their security is being ripped apart. I don't care what side of the line you were on. We all shared that feeling, and yet it caused the most amount of separation I've ever experienced.
And you live in a much more populated area than I do, in a bigger city. And are you seeing those bridges being rebuilt? Are people reconnecting and getting back, or has that disconnection sort of survived and we're still having that problem?
I think it's starting to. I think people are starting to come out of it a little bit more, but I also have seen a huge increase in anxiety around being in crowded spaces, around being in new environments. And I think I don't think it's about COVID specific, like the actual catching COVID part of it, but more, I just spent the last however many years home and away from people, and coming back into that, I've seen an enormous amount of increase in anxiety. I also think kids around 8 and 10, like that age range, have drastically been impacted because they were hit at the time that their development needed socialization so badly. That was the key period for them. And now it's almost like they were expected to jump past it and then now act like they got it, and they didn't. And so their anxiety is, record charts, I think.
So not to cause problems, but have you noticed how kids in that age range have gotten really bad at eye contact? Because I find myself going out of my way to kind of like, hey, buddy, like, no, over here, because you want to kind of rebuild that, right? And go through that practice with them. And, Jordan Peterson, who's obviously a really prolific figure, he has his 12 rules for life and all that stuff and whatever you feel about those. But one of them is to not let your children do anything that will make people not like them. And that seems like a really harsh thing to say, but if you read into it, what he's saying is because if they don't like them, they'll reject them. And if they reject them, they won't get that socialization that you're talking about. And when you don't get that socialization, your outcomes are not great, in terms of where you end up, And it doesn't mean if you don't have a buddy by third grade, you're going to jail. It's not catastrophic like that, right? But in terms of the odds and in terms of the stats, and not only that, your experience of life is going to be forever affected. It's better to go through with a team. It's better to go through with some buddies to reflect off of you. So you may grow up and get a diploma and get a job and get into relationships and things like that, but are you really getting the full life experience and the joy out of that you could? So I don't know. I think you're onto something with that. So again, other than trying to like harass kids in public to look you in the eye, what do we do about that? Is that a parent responsibility? Is that a school responsibility? Is it therapists? Like, how do we get them what they lost, or is it state dependent learning and we're just, tough luck?
I think some of it's adjusting expectations across the board. I hear a lot of parents talk about, like my kid had got everything. My kid has this, my kid has, we've done this. Why are they so upset? Why are they so anxious? And then pointing out to them, like, do you understand the anxiety that was built up? Let's be real. They were old enough to understand, especially when I type with that like 8 and 10-year-olds that are now, they were old enough to understand something's happening that's really scary, that some people are dying. I don't understand all of why. I don't know what's going on, but apparently this mask is going to save my life, right? Like, and that's all I really understand. And if I go to my friend's house, I'm going to catch it. Like, that is a terrifying concept for a little kid. I have somebody who's close to in my family who's about that age even, and she's an example. Anytime somebody coughs or sneezes around her, she thinks the class play is getting canceled. She thinks the dance recital is getting canceled, and so many kids that I see in that age range, it's very similar. Anything that resembles, oh, we're about to go back to that space. The rest of us, like to your point, the rest of us didn't think that was ever possible. And we got to live our whole lives almost going, all right, no, there's no such thing as a pandemic or a shutdown. And by the time it happened, we had tools to deal with it in a different way. These kids have only known a world where that's possible.
I had an experience with my children near the end of the mask mandates. And my kids, lucky, they've got support, resources. Like, I mean, from the surface, from the outside looking in, I felt like they navigated it pretty well, and I still think that they do. But there's a moment that'll stick with me forever where I was teasing my kids, which is a really good thing to do, is to harass your children and tease them and make them upset.
I say I'm fluent in Spanish, English, and sarcasm, so I'm all about it.
Yeah, the therapist is home poking at his kids. So, anyway. So what I was saying, they ended the mask mandates for our schools, and my kids had never really griped too much about it. But they knew that there was conversations. They knew that the adults were thinking about it, and maybe we were coming to the end of it. And so I was driving them home, and I said, hey, guys, great news. The school board met, and everything's good. And we're only going to do masks for one more year, that kind of thing. And I thought it was really funny. They collapsed. I mean, they had a breakdown, and it was really hard to see because it was the first time I got a sense of how distressed that was and distressing that was for them. And it wasn't funny. It was a big mistake, but I was glad that I saw it because I felt that was the first real look at how this had impacted them. And then we worked with that and we talked with that and dealt with that, but that's hard. Just the idea of doing that for another year. I mean, they were completely deconstructed by that. And like, I had to like pull over and like do some dad stuff, you know what I mean? Because it was a bad moment, And so times a million, right? Times however many kids we have in school, times kids who don't have the resources that my children have, times the kids who don't live with a therapist and can do some brief interventions, right? Like it's scary to think about what the damage, right, it might really have added up to there. So.
Well, they also don't understand, what do you mean it's over? Like, why is it over? My husband makes the joke sometimes where he says, like, nope, COVID's over. Biden said it's over. So it never happened. It's all good. It was declared. Like, it's been declared that it's over.
You got a piece of
And
paper. Yeah.
yeah, yeah, like, all right, so you can't catch it now. And there were silly things that kids would pick up on. There was a pool in our area where they said, our pool, and my kid heard this, like, the pool is closed earlier now because of COVID. And I had to tell my kid, I don't know, COVID comes out at night, I guess. I don't know why the pool hours impact the effect of COVID. So it's also we didn't understand. We were all confused. And so we don't know how to answer their questions. And we, so far in their lives, have been able to answer all their questions. So it was such a triggering experience for kids overall.
That's really a deep statement as a parent. Up until now, I've had all the answers for you. And now in this moment, I have to sit here and go, I don't know. I don't have the answers.
And you don't even know if your choices were the right ones. You just know that it was your best bet at the time with what you knew.
With this, surge in anxiety and surge in this, trauma experience, what do you think the future holds? Like, what's the next step in our understanding of this, and what's our next step, either as therapists or as a society or as families, and what we can do to make this a safer place or deal with the damage that's been done? Like, where is this going as a topic?
It's very easy to talk negatively about social media and some of the impacts and stuff, but I do think there's a very big positive side to it, like this platform right now, right? That you and I get to connect, and that you're spreading this information and knowledge to people in a really practical way that they can take in, they can soak it in. I think that it is about spreading awareness. I'm also grateful that there are organizations like the NBA, for example, like, they do a lot to try and spread awareness on mental health and that it's happening. And even, unfortunately, kids, they still are going to look to celebrities for information. And there has been a bigger outpour of mental health affects everyone. So there's part of me that's really optimistic that we're starting to talk about it more and more. And at least I can say in my lifetime, it's only increased. It has not really gone down. So that part of me, I'm really optimistic about. I love things like mental health first aid is spreading around our country more and more, where people are getting the tools to be able to assess and recognize warning signs around them. Unfortunately, some of the systemic problems in our school systems, like if you're in a really well-funded community, you are getting mental health courses and trainings and providers. But due to things like systemic racism, unfortunately, the part that I struggle with is the communities that desperately need those types of tools and resources are absolutely not getting them. And it's so quick that people make these assumptions about minority kids being problems. And again, my air quotes, right? Like, and all of these things, when in reality, it's the system that's failing them. So I'm kind of talking, I guess, in a windy road here, but
That's great.
That's
great.
But I think it's about us recognizing that it's not just about mental health. It's the system as a whole. It's where our money is coming from, where our resources are being allocated, and how we recognize each other, how we approach each other. If you look at someone and you have decided that they are trouble and no good, you're already stopping yourself from wanting to support and help them, and recognizing that that's your bias coming into play.
Like that horrible thing you said about me being a Red Sox fan, right? Like that would have shut down.
I'm a White Sox fan, so I almost hung up when I just made such an assumption, but
no, I think our way out is rooted in connection. I really do. I think we have to walk out of this place together. It's one of those weird kind of like, we all have the key, but the key doesn't work unless we all use it, right? And so we're stuck together with this. We're experiencing this together, and it's so easy to go to the blame game and point at this and that. But in any other situation, back to your point about the schools who need it the most get it the least, right? There's really not any other system where you would identify the biggest need and send the fewest resources, right? If it's a war and they have the most troops, you wouldn't send the fewest tanks, right? You would send the most tanks, If it's a healthcare problem and it's cancer, and one state has it 10 times more, you wouldn't send the fewest cancer doctors, you'd send the most, So it's a well taken point as to why is like, well, we can analyze it all day, we can study it all day, but let's identify the need and let's connect on that and get the resources where they need to go,
To me, the foundation is there is not one person in this world that is more important than another. There's not one, right? Maybe to me, my son is most important to in my heart or whatever. But at the end of the day, he's not more important than anyone else's kid. He's not. No person is. And this is back to some of that appreciative curiosity component again, is also that we have to get rid of this lens that we know what people have been through, that we know where they're coming from. And when we see someone behaving in a different way than we're used to, or having a thought process that's different, how many questions did you ask? How many times did you try and understand that person in a better way? So I tend to tell people, while trauma is horrific, and I wish I could say that no one had to go through, I wish I could remove it. At the end of the day, I do think trauma really increases our capacity for connection, because when you've been through trauma, you start to see that others have been through it too.
Well, and to connect to your idea of pacing and being inquisitive and naturally curious, I've always kind of carried this with me in session that I have this little rubric in my head where every question I ask gives me a quarter, right? And every statement I make costs me $1. And so it kind of puts me in a place where I'm always asking 4 questions before I'm making any definitive or declarative statements, right? And I actually do. I mean, maybe it's a little OCD, I don't know, but I keep a running total in my head of my emotional balance, right? And so if you say I'm dealing with X and I go, what's that like? How long you've been dealing with that? How does it impact your life? What have you tried so far? Okay, now I've earned the right to say, I think this might be helpful for you. And now I'm back to 0 and I have to go back through earning my quarters until I can make my $1 statements.
I love that. Now I might steal that one from you.
There you go.
Now we're even now.
I've got the fringe. You take the $1 and we're off and going. So you're welcome to it. And listen, we're wrapping up here, Chris. So I want to tell you, just from a sense of honor and appreciation, I thank you so much for the ideas that you've brought. I think when we talk about connection, people like me and you sitting here and connecting, even if it is, via technology and things like that, and these ideas getting out, I want to come full circle and think about you as a 6-year-old hearing for the first time that your ideas matter, and then as a 26-year-old telling another child your ideas matter. That's the way out, is paying that forward, having those experiences, and then sharing that with other people. So I just think that's beautiful, and it was beautiful for you to share that. So thank you for that today.
Well, thank you. You just gave me goosebumps a little bit. I don't think anyone's told my story back to me in that way that made it sound so much more like magical, I think.
No, I was really struck by it. It is magic. And I think it's great that you're part of that. I think it's great that you felt comfortable to share it. How do we find you? We want to learn more about you. We want to tap into your ideas. We want to be part of Olive Branch. How do we connect?
Olive Branch Mental Health on Instagram is probably the best way to reach me. I'm on there all the time, probably saying things people do or don't want to hear about from my world, but I am constantly posting things about trauma. Some of it's about kids, some is, more broad than that. And and then within the Instagram, you can get all the other contact information with me. And I would love to hear from anyone who wants to reach out. Absolutely.
That's awesome. Yeah. All right. So we'll wrap here. I appreciate you so much. Thank you again for the time. For anybody watching or listening, if this episode has sparked some authentic curiosity for you, or if you've heard something along these lines of isolation, disconnect, symptomology that you feel like maybe life could be a little bit better and you're looking for ways to connect, if you're in the Chicago area, is that where the right area to point them towards you? You're looking at Olive Branch. Is that where you serve? Yeah.
If you're anywhere in Illinois, really, because I do have telehealth as well as in person.
Yeah, if you're anywhere in Illinois and you can say it properly, you can connect with Chris, and that'll be good. And if you're anywhere in Ohio, New Hampshire, I always want to give a shout out to our sponsors, Anew Behavioral Health, psychiatric services, nurses, therapists, case managers, addiction, mental health. They're standing by ready to be authentically curious about your situation, connect with you, and help you get right on the back on the right track again. So a final thank you to Chris. Go Sox, right? It's that season. Yep. We're excited for the South Side. And for everybody else at home, thanks for watching. Until next time, take care of yourself and take care of each other. Thanks so much. Hey guys, although Through Helping Back is an excellent podcast with a lot of great ideas, I do want to let you know that in no way is Through Helping Back expected to be perceived as or relied upon in any way as specific medical advice or mental health advice for you personally. The information provided through Helping Back on our website or our podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment that can be provided by your own providers. Do not use our content in lieu of professional advice given by qualified medical professionals, and do not disregard professional medical advice or delay seeking professional advice because of the information you have read on our website, heard on our podcast, or otherwise received from us. Although we love discussing issues related to healthcare, mental health, and addiction, we are not providing direct healthcare, mental health care, medical, or nutrition therapy services. We're not attempting to diagnose, treat, prevent, or cure in any manner whatsoever any physical or psychological ailment, any mental or emotional issue, disease, or condition. We are not giving you specific medical, psychological, or religious advice whatsoever. Please take care of yourself and take care of others as you always seek the advice of your own medical providers and your own mental health providers regarding any questions or concerns you have about your specific health, or before implementing any recommendations or suggestions from us. These are ideas that have worked for other people. We think it's important to share them. We do not guarantee that they will work for you specifically. Do not stop taking any medications without speaking to your physician, nurse practitioner, physician assistant, mental health provider, or any other healthcare or medical professional. And if you have or suspect that you have a medical or mental health issue, contact your own healthcare provider promptly. Also, one last thing, if you know or suspect that you are currently experiencing a crisis, it is absolutely imperative that you seek the advice of your doctor or other emergency healthcare services prior to ever thinking about using our content. We love the conversations. We're glad you're stopping by. We hope you take a lot from the content. But again, for your specific individual medical situation, please always seek quality personal care from your own providers. Do not let this information or this advice stand on its own. Thanks so much for listening.